All right, so I'm sure we'd all agree that sleep is essential to human health and well-being. But there are some people who always feel tired, they snore badly and find it difficult to sleep. If that's you, don't overlook this, okay? So to discuss what to do when you're having trouble sleeping, we're joined by Dr. Neera, who is from the Mediclinic in Sandton. And basically, she's going to tell us, how do we avoid, or what can we do to help ourselves, basically? Doc, thank you so much for your time. We really do appreciate it. So, I mean, oftentimes, okay, I've had instances where I would sleep a full 8 hours, but I still wake up feeling incredibly tired. And I think everyone can attest to this. And especially during this time, we're all having end of the year fatigue. When do you know you've actually got a problem or you have a sleeping disorder?
Good morning to everybody. Hopefully there's no sleepyheads in the house. So I'm a neurophysiologist practicing at Sandton Mediclinic, and I have a deep interest in sleep disorders. And in my clinic, I see a lot of patients with different sleep disorders. And if you have trouble sleeping, where you present with insomnia. It depends what sort of symptoms you're having. If you have daytime fatigue, if you have a general wear and tear, constantly feeling for that nap during the course of the day, you know you're not getting good restorative sleep. And that's when you should come into the clinic and have an assessment. We carry out a sleep test to ascertain what sort of sleep disorder we are going to be treating. And, we can't discount the magic of sleep and the function of our sleep. In modern society, I think a lot of us are sleep deprived. And sleep is a natural process. It's a biological necessity. It ties our bodies to good health, and health is our wealth. So having a good night's sleep is certainly something that we need to take seriously, because we as adults, we spend about 26 years of our lives asleep. So sleep is just as important as eating.
Yeah, and I mean, if you look at life and, events such as stress or trauma that people would experience in their lives, is it normal, for our sleeping patterns to change, considering or dependent on whatever life event you're going through?
Absolutely. From childhood to adolescence and then into our adulthood, sleep definitely does change. Currently, I'm seeing a lot of women in their menopausal state, perimenopause and postmenopausal periods, and they most certainly have disrupted sleep patterns where the hormones, the estrogen, the progesterone that is being secreted is now on the decline. And that impacts the sleep because these hormones play a significant role in sleep. Firstly, these hormones initiate sleep and ensure that sleep is sustained during the course of the night. And there are various factors that disrupt sleep, especially during menopause. So we have to get the hormones in check, and then hopefully these sleep cycles will fall back into play.
Yeah. And does the duration or frequency of sleep actually matter?
Yes, absolutely. So the golden number that we look at is 7 to 9 hours. So during sleep, the brain actually cascades between REM sleep and non-REM sleep, and there are 4 stages of sleep. So yes, it is determined by the sleep quality and the quantity of sleep. So the term sleep like a baby, is definitely one that we often look at and we say, is it possible to even sleep like that if you've got underlying medical and psychological conditions? So, as I previously said, that you've got to actually, when you're speaking to your healthcare professional, is understand the symptoms and the impact it's having on your brain, on your health, on your cognition, and your daytime functioning. So it's extremely important to have a sleep schedule. And that sleep schedule should be regular, and we have to actually have a wind down time where you prepare your body for sleep. You can't go to bed with a phone and be scrolling and then expect your brain to fall asleep. No, there's a process in place for all the endocrine systems to kick off. Melatonin actually increases, in the evening. So you've got to allow your body to enhance these neurotransmitters and get prepared for sleep. Yes. So sleep quality is extremely important.
Look, some may turn to alcohol, sleeping tablets, or even stay on the phone when they're having trouble sleeping. So, what sleep habits improve your chances of getting good, refreshing sleep?
Well, like I'm telling you about, if you're having any sort of toxins, intoxication, like alcohol, some sort of cigarettes, any sort of smoking. At the moment, we're looking at some research on vape and the impact it has on your sleep patterns. And they make you fall asleep quicker, alcohol in particular. Like I see patients that say, my aid is 2 glasses of red wine. Yes, you may fall asleep quicker. However, the quality of sleep is disrupted. So you have to refrain from having high caffeine, which is in coffee. So you have to have an early dinner, a lighter dinner, so there's no gastric reflux that can disrupt your sleep patterns. And very often, looking at your lifestyle modifications to improve sleep quality. The main one is the LED devices, your television in your room. All those factors are going to inhibit sleep initiation. So, diet is really important prior to bedtime. And also exercise. You shouldn't exercise at least 2 hours before bedtime. And keeping your room very cool, very, digital detox prior to your bedtime is important, because in this day and age, patients they take their devices into bed with them. So you often have to say to them, so what are you doing? Especially our insomniacs, they struggle with initiating sleep or sleep continuation, and they have disrupted sleep patterns. So once we've excluded all the medical conditions and the psychological conditions, then we can say, okay, let's do some good sleep hygiene. Let's do some cognitive behavior therapy, where it has been found to be far more effective than sleep aids.
Yeah.
Where patients now retrain the brain, almost rewire, because our brains are so neuroplastic. We're able to train the brain into good, regular sleep patterns.
Yeah, I mean, so can all sleep orders be cured, basically?
Depends what the cause is. Like in my lab, I see a lot of patients with obstructive sleep apnea. And that is where there's a cessation in the breath, in the upper airways, and the patient presents with snoring, daytime fatigue, and quite often they have drug-resistant hypertension. And often we do the polysomnogram, which is a sleep test where we monitor the different parameters like the brain activity, the breathing from the upper airways, the abdominal airflow, the saturation levels during the course of the night. Yeah. And then we're able to diagnose the type of sleep apnea the patient is experiencing. And we administer them with treatment. And the treatment for obstructive sleep apnea, or should I say the golden standard, is CPAP therapy, which is a device that the patient sleeps with. And that actually provides a positive air pressure into the upper airways. But there are surgical procedures that are being used currently, and then the patient's referred to an ENT, where the ENT will now assess the upper airways and look at the pharynx and the oropharynx and determine what is actually obstructing that airway. And a lot of patients are anatomically built in such a way where they are snorers. So then there's a whole lot of ENT nasal sprays that are given to the patient. And we monitor. The patient is then monitored. But and that improves their daytime functioning by using CPAP on a regular basis. And that improves their overall performance and longevity.
Fantastic. Dr. Neera, thank you so much. Really do appreciate your time. And I'm hoping that at least there's some viewers that have learned a lot about how to improve their sleeping patterns and how to maneuver, in particular when you're not able to sleep. Thank you so much for that. A neurophysiologist at the Sandton Sleep Lab, situated at the Mediclinic, Sandton. That was Dr. Neera. Thank you very much indeed.